Taking care of someone with extraordinary needs is a challenge, but to do that while balancing a career can be even more daunting. KX News' Guy Gregory tells us about the launch of a program that aims to provide more support to caring for those with extraordinary needs.
For the past 4 years, Toby Lundstedt has had to stay home and provide full-time care for her daughter.
I've been home with Adeline since 2020. She experienced an event called a hemiplegic migraine, and we realized after that event that me trying to balance my job as a manager and an occupational therapist in a skilled nursing facility while making sure all of her needs are met was just a little bit too much.
Lundstedt says after she left her job to take care of Adeline, she lost all her employee-paid benefits. Since then, her husband has had to work longer hours to pay the bills. She says many of their bills have almost doubled since they've had to pay out-of-pocket medical expenses. North Dakota Department of Health and Human Services just started a new pilot program to provide more support for people like Lundstedt, who face the daily challenges of working while caring for individuals with extraordinary needs. The Family Paid Caregiver Program.
You know, one of the things that, we have been looking at is how can we make sure that we can support families, to provide services closer to home. And there have been a lot of barriers and challenges right now with the workforce. Many of our providers that we contract with to provide these services are struggling with staff, right? They are not able to find the staff. And so unfortunately, some of our families are having to make those tough decisions about being able to work or keep someone enrolled in services.
Individuals who are legal caregivers and have an adult or child enrolled in one of North Dakota's Medicaid programs may qualify for the new program. First, they must apply with HHS. One way to apply is a new portal linked to the North Dakota HHS website.
I had to set up a portal and add Adeline into my portal and make sure that I had her North Dakota Medicaid number with me. That was probably the part that took the longest because I had to go grab it, right? And it was just pretty much some background information, talking about what types of services she already receives. And it's just my understanding they're using this first step to determine if an applicant meets all of the eligibility criteria.
And then we'll be sending out an assessment to the person and asking them to complete that assessment. And so the assessment will help us make that determination of if that care that they're providing meets that definition of extraordinary.
Assessment of all of the different needs in all the different areas is my understanding. So how much help does a child need with their daily living skills? How much help do they need, like social, emotionally? How much medication assistance, and are they immunocompromised?
Bay says the Family Paid Caregiver pilot program is a first step in providing more support to families that are having difficulties making ends meet while taking care of their loved ones.
It's something that we haven't tried in our services with primarily the children, and so I think it's an opportunity to get some resources out to families that really do have a lot of struggles.
Reporting for KX News, I'm Guy Gregory.
For more information on how you can apply for the Family Paid Caregiver Program, you can visit North Dakota's Department of Health and Human Services website.